Hello, my name is Patrick Brown, Mayor of Brampton, and I'm pleased to give our weekly COVID-19 update for the efforts that we're taking in the city of Brampton. I'm joined here today by some of our colleagues in Peel Region, Councillor Marta Medeiros, who is chairing the working group on reopening the city, Councillor Rowena Santos, who is the co-chair of the Social Support Task Force, and Dr. Lowe, who is the interim medical officer health for Peel Region, who will share in this update today. The first update that I wanted to give is that the city of Brampton is launching a Shop Local campaign, Support Local, to encourage residents to shop, eat, gift, and support local businesses. This is a tough time for our downtown, tough time for small businesses. We want to make sure that there is opportunities to support these small mom and pop shops. Our businesses need this support more than ever, given this just isn't a health pandemic, it's an economic firestorm. As businesses offer online shopping, curbside pickup, and eventually reopen, the Support Local campaign will be about giving them a bit of a boost to encourage residents to support local businesses during this COVID-19 period. There are many ways we can support our businesses, from ordering takeout food to purchasing gift cards and items to watching the Rose online performances. That's right, you can see the same arts and cultural performances that are famous at the Rose Theatre, and you can do so online right now in a safe manner. People can also show their support for Brampton businesses on social media by promoting their favorite businesses with the Support Local image and hashtag Support Local Brampton. I know every Wednesday I order in with my wife to support a local restaurant, and please share your experiences. Help us highlight some of the great businesses we have in the city of Brampton. To learn more about our Support Local campaign, you can go to www.brampton.ca/supportlocal. I also wanted to share today a bylaw update. There were 55 charges laid between May 12th and May 18th, which included the Victoria Day weekend. All charges were under the Emergency Management and Civil Protection Act. And I want to note, the work that bylaw does is not easy. You know, we had one instance in the last week where we had a bylaw officer that was assaulted, simply trying to keep our community safe. In this case, the individual was charged and actually subsequently assaulted a police officer as well. And there's no tolerance for people like that who seem to show no regard to their fellow residents. In the past week, there were 163 complaints received for residential social gatherings, which resulted in 19 charges. 17 of those charges were related to another parking lot gathering where individuals were not practicing social distancing. So let me repeat, it's not okay to have a party in your backyard. It's also not okay to have a party in a parking lot. Please use common sense. There was also 18 charges for non-essential businesses. Businesses that are not permitted to operate under the provincial regulations cannot quietly think they can go about their business and it won't be noticed. Our bylaw officers will notice, and there will be a penalty for such conduct. We've had some hair salons, 3 charges to date, 1 business and 2 home businesses trying to operate. I know everyone wants a haircut right now. I want a haircut right now. Trust me, I'm using too much hairspray so my hair doesn't stick up every day. But the reality is we have to listen to the advice of public health. And right now, that's something that they're not prepared to open. I also wanted to talk today about the eventual reopening. And one thing we have the benefit of in Peel Region is we've got some incredible leaders in healthcare. You look at Michelle Emmanuel at Trillium, you look at Dr. Naveed Mohammed at the Osler Health System, and of course Dr. Lawrence Lowe. And we have a call every day where we talk about the challenges we have in the region. And where in some parts of the province right now, you've really seen a decline in COVID, where it may, in some parts of the province, seem like there's no sign of it. That's not the case in the GTA, it's not the case in Peel Region. And so as much as the province is giving permission to have a gradual return to normal, we're not going to be able to return as fast in Peel Region because we have to put public health first. We have to put the health of our residents first. And I've seen news releases from other municipalities where they're going to open up team sports, whether it's baseball diamonds or basketball courts. We're not going to be in that position, unfortunately, in Peel Region until we really believe that the community spread is under control. And I have a graph to illustrate why we believe we're not in that position yet in Peel Region. This is the growth of cases in Peel Region, in Mississauga, Brampton, and Caledon. And we're still seeing growth. And the reality is this growth, even this weekend, we saw growth. We saw the provincial number gradually decreasing, but the growth is still happening in Peel Region, and we haven't fully flattened the curve. We're making progress. The physical distancing is working, and it's making a difference, but we're not there yet. And if we rush the reopen, if we bring team sports back right away, and I love team sports. I'm a hockey nut. I love playing hockey with friends, but we're not ready for team sports yet. And so for those eager to get on the baseball diamond or eager to play soccer, we're just not there yet. And this is the reason. We have to see the curve flatten, and we're going to take a cautious approach in Peel Region. I'm grateful that we have such incredible healthcare leaders like Michelle Manuel and Dr. Naveed Mohammed and Dr. Lawrence Lowe, and it would be short-sighted if we didn't listen to them. And you're going to have a chance today to hear directly from Dr. Lowe. So first up on our update, I'm going to ask Dr. Lowe to give his update, and then we're going to hear from Councillor Medeiros and then Councillor Santos. So on that note, Dr. Lowe, please share with our residents the progress we're making in Brampton and Peel Region and the challenges that we still have.
Thank you, Mr. Mayor, and good morning. As of yesterday, Brampton has had 1,743 cumulative confirmed and probable cases of COVID-19. 1,253 of those have recovered, and 59 of those have passed away. 431 cases remain active. There is a pandemic picture in our community that is being directed by the virus, which we are starting to bring under control, but also speaks to a continuing risk in our community. And there is also a reopening picture as restrictions get loosened. And I'm concerned that those two pictures are starting to look out of step for us here in Brampton and in Peel. Yesterday, we heard details around Phase 1 of Ontario's reopening plans, which expanded on various sector reopenings that have taken place in the last 2 weeks. A memorandum issued yesterday advised that certain outdoor facilities could be opened, though also mentioned that this should be done in respect of local epidemiological context and not made available for public use until it is safe to do so. As Mayor Brown identified, here in Peel and Brampton, while we have seen our new reported cases starting to plateau, we have not seen a decline in new cases in line with the province's own framework for reopening. Further, we have had 20% of all the new cases in Ontario in the past week, which is disproportionate to our share of the population. And dozens of COVID-19 patients still remain on the wards and in the intensive care unit of our hospitals in Brampton. Most concerning in Brampton, recent days have seen new cases that actually mirrored the level of new cases that we had seen when we had first taken the closure orders in March. So given this picture, I have actually recommended that our area municipalities delay any opening of outdoor facilities in the region of Peel until at least Monday, May 25th, and possibly later, depending on the picture of the pandemic. And I urge them to work with Peel Public Health to develop a considered approach to opening such facilities in our community. Any approach should include provisions for hygiene and disease prevention, public education on concepts such as physical distancing, and an aligned enforcement plan to prevent crowding and congregation. Now, I know people want to get out there, but let's not forget this virus moves and thrives on crowds and interactions, which will come as more of the community opens. I believe we will see a sustained decrease in cases if we hold tight, but we need to hold tight for the time being. So for the time being, stay close to home. Do exercise, but walk your sidewalks in your neighborhood or your bike paths or your active transport corridors. Enjoy your backyards. Enjoy the common spaces of your complex. And even as more things reopen, remember that 2 meters of physical distance, avoiding crowding, and using a non-medical mask where you can't will also keep you safe. And keep washing your hands. Know that I myself too want to get out there. I love Southern Ontario summers. My summer road trips always start by putting the window down and turning the tunes up with Tragically Hip on an open highway. You know that feeling. It's the anticipation that good things are coming, even if you're not quite there yet. And we're not quite there yet. So go ahead, play those tunes out your window, but do it when you're driving to the grocery store. Stay the course this weekend so that we can hopefully enjoy much more of the summer to come. Thank you, and I'll pass it back to the Mayor.
Thank you, Dr. Lowe, for your cautious and evidence-based approach. And now we're going to hear from Councillor Martin Medeiros, who's been chairing the working group on reopening, and some of the cautious approaches that he's recommended for the city to make sure that we are looking out for the residents and their health.
Thank you, Mayor Brown. Just to reiterate, as the doctor had suggested, at the City of Brampton, contrary to other municipalities, we're not opening any team sports facilities or recreational offerings such as volleyball or baseball, etc. We at the City of Brampton, our recovering working group, has started public consultations. It was very timely as of last week as we consulted with our sports user groups. And we heard from associations such as golf, tennis players, and with the provincial announcement, as of yesterday, May 18th, we opened up 21 tennis courts and 7 pickleball courts in the City of Brampton. We've added additional measures. For example, we're only allowed 2 tennis players on a court, 1 on each side. We're asking that tennis balls be marked, and we're also asking that there's no shared equipment. We will have staff who will be, city staff will be roaming the parks and ensuring that people are adhering to some of our guidelines. And also in regard to golf, we're opening up golf on May 22nd, this upcoming Friday. And again, we've applied additional measures such as having hand washing and sanitizers throughout the golf course. We're ensuring that there's 20-minute intervals from start play. We're also not allowing any walk-ons. Everything has to be by appointment, and also everything will be monitored and controlled. One of the additional features and why the City of Brampton has taken that extra step in not opening immediately as other municipalities, we want to ensure how we can open up and also provide and support some of our most vulnerable groups. And our seniors, for example, one of the additional features that we have are tennis courts. At our golf courses, we're having senior-specific hours. We heard from our seniors community that they want to feel safe, and we want to ensure that we promote them staying active. So again, Brampton is a leader when it comes to supporting our seniors, and our recreational offerings really reflect that. Going on over the next couple of weeks, we have an online survey, and we'll be continue to consulting with groups. And over the next 2 weeks, we will be monitoring what is open, our current golf facility, our tennis courts, and we'll be consulting with our public health experts to ensure if there's any additional measures and what else that may be possibly in the future that we can open up. So at the City of Brampton, public health, hygiene, and promoting social distancing remain #1 focus and at the center of everything we do. Thank you.
Thank you, Councillor Medeiros. And to reiterate, Brampton is not moving to that transition of team sports like some other municipalities are. And I should also add, we're hearing about other municipalities that have allowed off-leash dog parks to open. We have 4 of them in Brampton. They will not be opening. Once again, taking that cautious approach to areas that there could be a number of people based on the advice of public health. Our next update is from Councillor Rowena Santos, who will give you an update on the mental health services we're offering in Peel Region and some of the incredible acts of generosity that we're seeing within our city.
Thank you. We all recognize the significant strain that COVID-19 has placed on individuals and families across the City of Brampton. And as co-lead of the Social Support Task Force, together with Councillor Bowman, I've seen firsthand the dedication as well as the support that so many across the City of Brampton have stepped up to serve those in need across our community. Our residents are being challenged in a number of ways because of isolation, financial and employment uncertainty, and disruptions to daily life. These challenges can result in a low mood, worry, anxiety, substance use, social isolation, and relationship issues. It's important for people to realize that they are not alone and that there is help available. You know, as counselors, as elected officials, we struggle as well. It's not easy for us, and we find our ways to cope and reach out for support. And so we're encouraging you to do the same. There are numerous organizations through the region of Peel who provide support and information for mental health, including Peel Public Health and the Canadian Mental Health Association of Peel Dufferin. The City of Brampton's Social Support Task Force has a complete list of various resources that residents can tap into. And these include Peel Outreach, Street Helpline, CMHA, Peel Dufferin, 24/7 Mental Health Crisis, Knights Table, Regeneration, United Sikhs, as well as CalSAID, all who offer free meal delivery through the City of Brampton, as well as food hampers on a regular basis. We encourage those who need help to please visit www.brampton.ca/COVID-19. It's not an easy time. And one of the ways that we can deal and cope is by showing our generosity. And we know here in the City of Brampton, that generosity has been tremendous. I would also like to thank our entire community and businesses for coming forward and generously donating their time and their goods to help our residents. Kudos to everyone here. We are all in this together. Thank you very much.
Thank you. Thank you to Councillor Santos for the great work of the Social Support Task Force. I'd now be happy to take any questions that you have of myself, the councillors, or Dr. Lowe. And I see on our list we have Momin Qureshi from 680 News.
Good morning, Mayor Brown. Thank you for taking my question. I do have two for you. First of all, I just wanted to know what the situation is in Brampton in terms of PPE and how that supply is going at the various long-term care homes, hospitals, and the like, and whether you guys need a push to get more.
So the supplies have been coming in. The donations have been incredible. Last I checked with the hospital, they had an adequate supply. And so we don't have any immediate concerns. When we had some of the outbreaks in the long-term care settings, we spoke to those long-term care homes, made them aware of the provincial supply with Minister Fullerton, and that seems to be under control as well. Having said that, if members want to make donations, they're still welcome.
And you spent a good part of today's news conference talking about kind of pumping the brakes on opening up certain things just to be on the extra safe side. And we saw some stories floating this morning about people giving, black market haircuts, advertising on social media, going to certain locations, houses, and things like that to give those types of haircuts. I wanted to know if that has come to your attention and if it's a concern and what's being done about it.
It has come to my attention. Bylaw is aware of it. We've charged 3 individuals so far trying to operate their business when they're not on the essential services list. And for someone out there who may be looking at getting a haircut or having their business go door to door, recognize that for a $40 haircut, you'd be looking at a $1,000 fine. It's not worth the risk. Please listen to public health.
Thank you.
Thank you, Momin. Our next question is from Nida from The Pointer.
Hi, good morning. My question is for Dr. Lowe. Hi, good morning. My question is for Dr. Lowe.
Hi, good morning. Sorry, I'm here.
Thank you. So it was mentioned earlier during the press conference that the curve in Peel is flattening much more slowly compared to the rest of the province. What are the possible reasons for this?
Yeah, it's a great question, Nada. And the reality is that we are a large suburban and urban mixed public health unit. We're a very diverse region in terms of the number of people and the potential interactions that have been occurring. And to a large extent, I think the openings that have happened over the past few weeks while they may have a smaller impact in smaller population centers, if you're going to open something like retail, the reality is that you are essentially opening the whole community that moves around that. And so, I think a lot of the openings that happened maybe on in the early part of May may have had a bit of a bolstering effect in terms of continuing to push new cases up. And it's for that reason I've made my recommendations today.
And on the region's COVID-19 dashboard, there is no information showing how many cases were based on community spread, while in, for example, York region, that information is available. Why is this not available in Peel, and would this information kind of help slow the spread?
Thank you so much, Nita. It's a great question. In fact, that information is available in our weekly epidemiologic update. And so that actually, if you go to the top of our dashboard that says weekly epidemiologic summary, click on that. And if you click on there, I believe one of the tables actually speaks to community, institution, or close contacts and travel spread. I believe it's table 3. And that gets updated on a weekly basis. Certainly, we are constantly looking at the dashboard to identify other pieces of data that may be of use to the public, and that may be one of the indicators that we would be looking at in the future. Thanks for the question.
Thank you.
Thank you, Nida. Our next up is Lucy from in Brampton.
Hi there, good morning.
Morning.
So my question is, this is a time of year that many people use as an opportunity to declutter and do their spring cleaning. While garage sales may be out of the question, are there specific guidelines that residents should follow if they choose an alternate way to get rid of or sell items to others, such as through online marketplaces?
So I would say that we have delayed garage sales, but that'll make the garage sales, once this is settled, even better opportunities to find new items and to sell items that you no longer have a use for. We have increased the garbage allocation in Peel region, understanding that people are at home. And so we have taken that step. In terms of if you want to market it online, I would suggest that you reach out to public health on the safe ways to receive and send mail.
Thank you very much.
Tabish from Red FM. Tabish?
Yes, good morning, Mr. Mayor. Thank you for taking my question. My question is about the reopening of economy, as province has started the process of gradual reopening, but as you took a kind of different approach and emphasized on not rushing for economy reopening, as Brampton is not fully ready to open. So do you think there should be a region-based approach on reopening of businesses?
Well, there is different realities in the province. And so the situation in Kingston or Barrie or Timmins is dramatically different than it would be in Brampton or Mississauga or Toronto. Having said that, with the free flow of goods and people, it's difficult to have two phases. And so I do support the province understanding that you simply can't have one geographical area open and the rest not open. And so I think the approach that we're all in this together is the prudent approach, but it just means that some of the amenities in Peel region that may be available elsewhere in terms of our own recreational amenities, we do have to take a more cautious and slow approach. I'm not sure Dr. Lowe would like to add to that as well, but in terms of Dr. Lowe, in terms of the importance of consistency within Peel region in Ontario, if Dr. Lowe would like to speak to that.
Thank you, Mayor Brown, and thank you, Tabish, for the question. I know that this is a topic of active discussion amongst different medical officers of health around the province. There is a recognition that the pandemic picture looks different in different health units. Some health units who have not had cases in a number of weeks now may be ripe for reopening. But as I mentioned here in the region of Peel, just in the last week alone, we've accounted for 20% of the new cases in Ontario, which is very much out of keeping with our proportion of the population in the province. So certainly it's something that I would encourage our decision makers to consider. And I know that with other medical officers of health around the province, we're looking at ways to make sure that we can report on more indicators that allow us to paint a picture on how this is unfolding differently in our communities. Thank you for the question.
Thank you, Doctor.
Thank you, Tabish. And our last question is Rajinder from Parvasi Media.
City of Toronto has decided to not allow more than 250 people gathering during festivals or events up to July 31st, and then more than up to 25,000 people up to August 31st. So what is the position of Brampton on this issue?
So we're going to wait for the provincial guidelines. Right now, 250 people events wouldn't be allowed under the province. And so we've canceled all our events up until July 2nd. I think it's safe to say that that's going to extend beyond that. Right now, the provincial order is for 5 people or less. Whether that increases to 10 or 50, frankly, that's possible, but this summer, if the province deems that to be safe. But the notion that we'd be having large events like 250 people is not something that I think we're going to be seeing in Brampton. And it's tough. We have lots of great events, but public health has to come first. And so if you're asking me for an estimate, I don't see events like that happening in Brampton this summer. And the reason being, once again, goes back to this chart. This is the chart that shows the progress that we need to make. And we need to see this curve flat, and we need to see community spread stop, and we're not there yet. So thank you, Rajinder.
Okay, Mayor, like last time, Brampton is the fastest growing city and it has its own challenges. How you see how the things will be after COVID-19? We are done with that. We are trying to come back to normal. What are the plans for the city having very limited resources?
Well, listen, it's going to be tough on every city. This isn't just a health pandemic, it's an economic firestorm. We've got an economic support and recovery task force that is working with our business community. We're a resilient community. We have resilient businesses and resilient residents, and we'll find a way to get through this as a city and as a country. We're going to need provincial and federal governments to step up. Those stimulus programs we've talked about before in terms of infrastructure could be a helpful catalyst, but to be clear, it's not going to be easy. This is unprecedented, and I think for everyone, we're in uncharted territories, but we will get through it. So thank you, Rajinder, and that covers all our questions today. Thank you for watching and listening to our weekly Brampton COVID-19 update, and thanks to Councillor Marta Medeiros, Councillor Rowena Santos, and Dr. Lawrence Hulot of Peel Public Health for being part of this update today. Okay, good job, everyone.